In 1847, if you were a new mother in Vienna, one of the most dangerous things you could do was give birth in a hospital, not because of infection you brought with you, not because of bad luck, because of the doctors. One young doctor was about to figure out why. His name was Ignaz Philipp Semmelweis, born July 1st, 1818, in Buda, back then its own city, across the river from Pest, long before the two merged into Budapest. He was the fifth of 10 children. His father was a spice trader, whilst his mother, Theresia, came from Swabian German stock. He didn't start out chasing medicine. His father wanted him to become a judge, so Semmelweis began studying law. Somewhere along the way, he switched into medicine at the University of Vienna, and by 1844 he had his degree and a specialty: obstetrics, delivering babies. He took a post as assistant physician at the first obstetrical clinic of Vienna General Hospital, and that's where he stumbled into a mystery that had been quietly killing women for years. The hospital ran 2 maternity clinics. The first clinic was staffed by doctors and medical students. The second was staffed by midwives. Women in Vienna knew something the doctors wouldn't admit. The first clinic was killing them at a far higher rate. Mothers begged not to be assigned there. Some chose to give birth in the street rather than walk through its doors. The killer had a name: childbed fever, or puerperal fever, one of the leading causes of maternal death in the 1800s. And the leading theories of the day blamed everything except the truth. Bad air, miasma rising from the wards, overcrowding, even the emotional distress of the mothers themselves. Nobody suspected the doctor's own hands, because nobody yet knew that germs existed at all. In 1847, a colleague of Semmelweis, Jakob Kolechka, died after accidentally cutting himself during a student autopsy. A small wound. Within days, he was dead, with symptoms that looked disturbingly similar to the women dying of childbed fever. Semmelweis read the report on his friend's death, and the pieces clicked into place. Medical students in his ward performed autopsies most mornings, often on the very women who died of childbed fever the day before, then walked straight into the delivery room. No real hand washing, just cadavers, then newborns, on the same unwashed hands. Semmelweis's conclusion? Doctors themselves were carrying something invisible from the dead to the living. He didn't know what bacteria were. He had no microscope evidence. He just had the pattern and the courage to trust it. Semmelweis ordered every doctor and student under him to wash their hands in a chlorinated lime solution before touching any patient. He chose that specific solution because it was strong enough to strip away the lingering smell of the autopsy room, the smell he believed carried the disease. The results were staggering. Mortality in his clinic fell from rates that had often exceeded 10% down to somewhere between 1 and 2%. Almost overnight. By the standards of 19th century medicine, he had solved a problem that had been killing mothers for generations. He'd essentially discovered infection control years before germ theory existed to explain why it worked. You'd think this would make him a hero. Instead, it nearly destroyed him. Here's the problem. Semmelweis's discovery wasn't just a medical finding, it was an accusation. He was telling respected physicians that their own hands, fresh from the autopsy table, had been killing patients for years. And he couldn't back it up the way 19th century science demanded. Germ theory didn't exist yet. That breakthrough was still years away. waiting on Louis Pasteur. All Semmelweis had was correlation and hospital statistics, not a mechanism. Miasma theory, the belief that disease spread through bad air, was still the establishment's answer, and it was hard to dislodge. Some colleagues genuinely doubted the theory. Others were simply insulted by the implication. Support trickled in from a few sympathetic physicians, but the wider medical establishment largely closed ranks against him. Eventually, he left Vienna for Budapest, where he introduced the same hand-washing protocols, and maternal deaths dropped there too. The method kept working. The world still wasn't listening. In 1861, he published his major work, The Etiology, Concept, and Prophylaxis of Childbed Fever, laying out his full argument that hand disinfection could prevent most cases of the disease. It landed to indifference and criticism. The book that should have changed medicine changed almost nothing, at least not yet. The years of rejection wore him down. By the early 1860s, those around him noticed his behavior growing erratic. The constant attacks on his work, combined with his own mounting frustration, seemed to be breaking something in him. His wife, Maria Weidenhofer, they'd married in 1857 and had 5 children together, though only 3 survived infancy. Grew desperate enough to reach out to a family friend, Professor Hebra, for help. In July 1865, with Hebra's help, Semmelweis was admitted to the Viennese mental hospital in the Dublin district. He died there 2 weeks later, on August 13th, at just 47 years old. The cause of his death has been debated for over a century. Some accounts point to a beating by asylum staff. Others suggest he may have contracted syphilis years earlier during an autopsy, leading to progressive neurological decline. What forensic examination in the 1960s did confirm he died of sepsis from a lingering bone infection in his hand. In other words, the man who discovered how infection killed new mothers ultimately died from the very same kind of infection himself. Within about 20 years of his death, everything changed. Louis Pasteur's germ theory finally gave the world what Semmelweis never had: proof that invisible microorganisms cause disease. Joseph Lister applied the idea to surgery with antiseptic technique, and death rates in hospitals worldwide began to fall. Suddenly, the obsessive hand-washing of a disgraced Hungarian doctor looked less like the delusion that got him locked away, and more like one of the most important insights in the history of medicine. In 1969, on its 200th anniversary, the Medical University of Budapest renamed itself in his honor. Today, it's known as Semmelweis University. He's remembered as the savior of mothers. There's even a psychological term named after him: the Semmelweis reflex, the tendency to automatically reject new evidence because it contradicts what we already believe. Named after the very man that reflex helped destroy. Every time a nurse or doctor washes their hands between patients today, they're following a rule one man paid for with his career, his mind, and ultimately his life. He wasn't wrong. He was just early. And in a room full of people who don't want to hear it, being early can be its own kind of tragedy. Subscribe for more forgotten history